Good afternoon, everyone, and welcome to today's webinar on COVID and health and safety. Hope you find this session useful. Well, to introduce myself, I'm Lynn Livesey, and I'm joined today by my colleague Victoria Anderson. We're both senior associates in the health and safety team at Brodie's. And we're joined today by over 200 guests from a variety of industries, ranging from the construction sector to healthcare. Many of you actually attended our last webinar on the topic of COVID and health and safety. Well, we're now almost a year into the pandemic and some things haven't changed. We are still working from home and delivering this session virtually rather than in person. But today we're going to have a look at what has changed, what we've learned so far, and also provide some compliance advice that should apply across the sectors. Firstly, I'm going to have a look at the legal framework and some practical considerations for ensuring compliance, such as COVID risk assessments and the hot topic of vaccines, cooperating with your HSE Spot Checks. Victoria is then going to talk us through a real world example to put all that into context, as well as discussing the challenges of home working and a reminder of the consequences for failure to comply with health and safety duties. So if we turn to have a look at the legal landscape first, in which we're operating, when you're considering your health, safety and welfare, organisations should take account of the legal framework and the government guidance which has been constructed in response to the pandemic. By way of reminder, the key piece of legislation is the Coronavirus Act 2020. It is an act of the UK Parliament, however, most of the Scottish regulations have been made under it. It was followed by the Coronavirus No. 2 Scotland Act, and then we have the local level regulations. And those are the regulations that impose current restrictions on individuals, businesses and service providers in Scotland. And that includes the level 4 restrictions that everyone in Scotland is currently operating under. So those regulations provide by law that everyone must stay at home unless they have a reasonable excuse for leaving the house. How long these restrictions will remain in place is currently being considered, and the government has suggested there may be some easing of the restrictions early next month. But the changes in law and the government advice has changed the way in which business is provided, and it's required more lateral thinking as to the arrangements organisations need to have in place. For example, in the retail sector in Scotland, the most recent change was businesses requiring to operate from a hatch rather than allowing members of the public into their premises. But what's key from a health and safety perspective is ensuring that your organisation is keeping abreast of the changing law and guidance so that the business knows what they need to do to be compliant. So we have this new legal framework. However, many of you will be aware the overarching health and safety duty incumbent upon an employer hasn't changed during the pandemic. It remains to ensure, so far as is reasonably practicable, the health, safety and welfare of employees whilst at work, as well as those non-employees who physically interact with an organisation, such as your contractors and your members of the public. So if we move on to consider what's central to that health and safety duty, and that is the duty to risk assess. COVID-19 has certainly introduced new issues and risks that need to be considered and managed. Many pre-COVID risk assessments and policies have automatically been rendered defunct. The overriding duty on an employer in relation to COVID is to minimise or eliminate the risks of transmission insofar as is reasonably practicable. That is, as many of you I'm sure are very familiar, a very wide-ranging and extensive duty which covers all aspects of a business. In the past year, Victoria and I have worked with many clients on their COVID risk assessments, and with knowledge and practice of operating during a pandemic evolving, COVID risk assessments are something that many people listening will be very familiar with. Many of you will already have taken steps to ensure your employees have a safe working environment, including physical distancing at site, considering your appropriate PPE, increasing your cleaning facilities. However, as the guidance is updated, COVID risk assessments can very quickly become outdated, or at least not be as up to date as you might expect. So what I'm going to briefly consider is just some of the common themes that we've considered in terms of COVID risk assessments. But my key takeaway would be to ensure that that risk assessment is regularly reviewed and that you're keeping a paper trail of that process. The situation's fluid. Risk assessments need to flex and be revised as the government guidance is updated. So ongoing review really is necessary to ensure that those risks are being appropriately managed. As you may know, the current stay-at-home regulations place duties on employers to take all reasonable steps to minimise the spread of coronavirus. That includes supporting staff to work from home if their roles can be undertaken remotely, and Victoria will touch on home working shortly. However, current guidance permits certain people to be able to be at work, with the anticipated easing of restrictions in the months to come, that number is going to increase. So if your organisation does fall into that category, where your employees are permitted to be at site, presently you should be considering the minimum number of people that you need on site to operate safely and effectively. And that should include considering the people on site that are visiting your site, such as contractors, any staff that are contracted to clean or do maintenance, and keeping a record of contact details of people that are visiting your site can assist if you're later required to provide information for track and trace purposes. And one thing to consider when you're thinking and assessing about that minimum number is whether there's any requirement in your insurance policy in relation to that. If there is, that's not simply to say you can rely on the figure in the policy, because the policy might actually not take into account COVID restrictions. And so your COVID number might actually be below the number that's in your policy. But if you assess that it is below what's in your policy terms, we would recommend that you contact your insurers to advise them of the operations in place, just to make sure there's no accidental breaches in terms of your policy terms. And if your workplace is operating at a reduced number, have you considered what then happens if you have an accident? Is there someone with first aid training within your minimum numbers group? Has anyone in the group undertaken an incident response training course? Do you have fire marshals? Do they know who to contact if there's been an emergency? And do you maybe need to consider producing additional information sheets about this? These are all things to think about. Another thing to consider is if your assessment's taken into consideration how your employees are attending site. Health and safety duties on employers have been extended by the government and HSE guidance. Pre-COVID, the employer's duty started at the doors of the workplace, but that's been extended to include your employees' commute to work. So where possible, people should be avoiding public transport, and organisations do need to know how their employees are commuting, so that can inform any assessment of transmission risks in the workplace. It can also guide their thinking on what measures need to be in place for people arriving at site, such as hand washing facilities or sanitising facilities at the doors. Organisations might also want to consider staggering their start and finish times to reduce the number of people arriving at site at the same time. However, I'd flag that there are employment law considerations there in relation to if you're changing shift patterns that are set, so that's just something to be mindful of. Many of your organisations will also have already carried out the exercise of assessing the touch points on site, which could increase the risk of transmission. And each organisation's setup is going to be different. However, frequently considered areas that are considered to be hot spots are things like the communal kitchen, door handles, lift buttons, and removing unnecessary touch points might be another way in which you can demonstrate that you're discharging your legal duty to ensure the risk of transmission is as low as reasonably practicable. And it's best practice for all organisations to keep a written record of what touchpoint hotspots have been considered or removed, and list any control measures that have been put into operation. And it may be as operations change that your touchpoint hotspots change, and so again, regular review is needed of this process. So once you've got your risk assessment drafted, also do remember that you've got a legal obligation to consult your workforce in relation to the health and safety arrangements to ensure that there are consultations taking place, whether that's with your health and safety committees or your trade unions if you've got a unionised workforce. Communication with staff is key. Employees need to be aware of the steps an organisation is taking to minimise the risk of transmission of the virus and any other dangers in the workplace as a result of COVID. So that's a look at COVID risk assessments. If we turn now to consider vaccination, the majority of the workforce is still working from home. However, many see the vaccination programme as the roadmap back to the traditional workplace to enable employers to resume normal operations. Some high-profile employers have announced the introduction of no jab, no job policies. And there's currently a lot of press coverage on whether employers can or indeed should impose workplace testing with a mandatory policy. Whilst this could be a step for employers to take with a view to protecting the health, safety and welfare of their employees and others, and also providing a safe workplace, employers need to carefully consider any vaccination strategy. Vaccines are not 100% effective. The government has not legislated to say that the vaccine is compulsory, even for frontline workers. There's the scientific evidence regarding the effectiveness of the vaccine in terms of limiting the spread of transmission is still emerging. And it might be as further evidence emerges, there is justification for vaccinations in the workplace, or certainly an increased justification. However, there are many reasons why an employee might not want to be vaccinated, whether that be for religious, philosophical, or medical reasons, such as age or pregnancy. It is an intrusive procedure and it does need consent. So a business may wish to consider a voluntary process in terms of voluntary policies which strongly encourage vaccination rather than a mandatory one where vaccination is required. But any vaccination strategy should form part of the COVID-19 risk assessment that I've just been discussing. And again, communication with your workforce regarding this is important. Considering how the vaccine is going to interlink with other COVID secure measures in the workplace, such as your social distancing, screens, home working, also needs to be carried out. That said, there will be particular sectors such as health, social care, or where you've got staff working with in close contact with vulnerable people, where there might be greater justification for vaccines. But those should be considered on an individual basis. For example, you might not have a blanket ban that a person can't work without a vaccine, but there may be certain tasks that it's deemed inappropriate for them to carry out. It's going to need careful consideration and an assessment on a case-by-case basis. Because in addition to the points I've already raised, there are potential personal injury issues with relation to vaccination of your employees, if employees were to go on to suffer side effects as a result of the vaccine. And there's also employment law considerations such as unfair dismissal, grounds for discrimination claims. Has your organisation considered what's going to happen if an employee refuses or fails to comply with your policy on vaccination? And then there's also data protection considerations to take into account. Actually, our colleagues in the employment team have written a very helpful blog that covers a lot of these points, which is worth a read, and we will circulate it in follow-up with the recording. So the last thing I'm going to have a look at is HSE Spot Checks before I pass you on to my colleague Victoria. So the HSE is continuing to exercise its regulatory function during the pandemic, ensuring ongoing compliance with health and safety legislation, and also taking action against employers who are not appropriately responding to COVID. We know that HSE are carrying out spot inspections to ensure that businesses are, as they describe it, COVID secure. And there's been press coverage about this because the HSE have been working with local authorities and have hired private firms to carry out inspections. And if such an individual, so not an HSE inspector, but an individual from one of these firms turns up, they're known as a Spot Checks support officer, and they should be carrying a letter confirming that they have authorization to carry out that work. If that letter is not volunteered, we'd recommend that you do request sight of it, simply to ensure that the person has the authority to inspect your premises. It can also help to have procedures in place so that staff know what to do when an inspector calls, who should be directed to speak to the inspector. it really should be someone that's got sufficiently senior within the business, who's familiar with the procedures in place to minimise the risk of COVID, and also knows an inspector's powers in terms of viewing premises, speaking to staff, etc. The paper trail we've been mentioning already is going to be of assistance if an HSE inspector turns up, as you'll most likely be asked to produce written documents that support the business's procedures for ensuring that the site is COVID secure. They'll most likely want sight of that COVID risk assessment I've just been discussing, as well as things like training records, communication with the workforce. So it's really important that records are kept of all of this and are also easily accessible. But having the correct paperwork is not the end of the matter. The authorities are going to expect to see evidence and procedures, that there's supervision, and ensuring that these rules are actually being followed by the workforce. And it's also important to know that an inspector will probably want to retain the paperwork rather than simply see it. So organisations should ensure that their employees know that they should be simply handing over copies rather than the original documents, so that you're still retaining the documentation. And lastly, what I would say is, while an organisation has a duty to cooperate with any inspection, it doesn't mean that you need to capitulate. And if an organisation is ultimately issued with a notice that you would fundamentally disagree with, you don't have to simply accept it without a means of challenge. And that's something Victoria is going to discuss shortly. My comment on that would be, it is quite a short period within which a notice being issued can be appealed. So organisations do need to react quickly. And it therefore helps to have internal procedures in place so that you know what to do when a notice is served. So I'm now going to pass you over to Victoria, who's going to talk us through a real life example to put all of this into context.
Thanks, Lynn. Good afternoon, everybody. So picking up the baton of the HSE COVID Spot Checks, I thought it would be useful to look at a real example where one of these checks has taken place and has hit the headlines as a result. It's quite difficult in all of this discussion, as we appreciate, to take the real or the realistic approach out of this abstract theme. Some of you might have seen in the press that health and safety executive inspectors had received a call from a concerned employee of the Department for Work and Pensions. And the concern related specifically to the measures that the DWP was taking in relation to managing the COVID risks. HSE duly attended at DWP's Leeds office, and following an inspection issued a notice of contravention detailing a list of things that they found in the offices which they considered to be a material breach of health and safety law. Now, for those of you who may have joined some of our earlier health and safety webinar sessions, a notice of contravention is something which may be familiar to you, but it's the vehicle by which the health and safety executive indicate to a duty holder, an employer, that they have fundamentally breached their health and safety duties. That's quite a statement in the context of COVID. Now, we have been saying from the beginning of the pandemic that there was always scope for prosecutions and action to be taken under the wider health and safety laws, not just the COVID laws that Lynn has just talked about. And this example is a very clear message to employers that the HSE will consider taking action under those laws, which have more serious consequences in certain cases. So the first thing that I would like to go through in this example is to discuss the things that HSE identified as being material breaches of health and safety law. And this ties back nicely into what Lynn was discussing about the risk assessments. The first issue that the HSE raised was in relation to access and egress to the DWP's building in Leeds. What they said in their letter was that there did not appear to be any consideration or assessment done in relation to avoiding overcrowding at the access and egress points. Now, what they're talking about there is the queues around the turnstiles of a multiple occupancy office building at 10 to 9 or 10 past 5, as the case may be. What's really interesting about the wording that we saw from this notice of contravention is the phrase, "there doesn't appear to have been." And that ties us back to the importance of committing your thought processes around your COVID risk assessment to writing. If the HSE arrive at your premises and it cannot be evidenced through your risk assessments and any other associated documents that you have given consideration to these things, then it's very easy for them to assume that you've given no consideration to it and therefore have materially breached your health and safety legal duties. In relation to avoiding it, definitely have it in writing. It doesn't have to be in the risk assessment itself. If there are things that you have discounted as not being possible or practicable for your workspace, you can have that detailed in an additional document. But not having it in writing at all is a problem. It's the old adage of show you're working and you'll get some points at least. The second point that the HSE raised with DWP was in relation to movement around their offices. And if we take a look at the pictures on the slides, which is just these two here. Now, if you see on the left-hand side, we have a walkway which has been taped out in yellow tape from one side of the office to the other. The picture on the right is of a similar route, but on a different floor of the office. Now, the main criticism that the HSE raised here was the lack of planning. They said that this walkway was not wide enough to allow users to maintain a 2-meter distance. Now, we can't measure the floor from the photographs, but if we accept that at face value, you'll notice down the sides of the walkway, there are banks of desks. Certain of the desks do appear to have been marked as not suitable for use due to social distancing measures. But perhaps understandably, the HSE were concerned that the desk closest to the walkway was apparently free to be used by their employees. Quite a simple thing, and it goes to the heart of really thinking pragmatically about the way that your staff use your office space. I think this is a really interesting point, and it's one that we would want to certainly discuss with clients if they had received a notice of contravention from the HSE on this point, because if we consider this office layout, where is the alternative traffic route for members of staff? Now, of course, I've never visited the office, so we can't comment on whether or not there might be alternative routes around the banks of desks. But if you do have slightly restricted area in your premises, there are ways with which you can adapt your practices to make it work. It's only to be, or the social distancing is only to be maintained insofar as reasonably practicable. Now, it's not reasonably practicable to have to build an extension to allow staff to access the toilets or the stairwells. So what are you going to do about that? Well, if you can evidence that you've issued staff-wide memos or policies giving advice on how to use this space and saying only move around the office if it's strictly necessary, and try to do so when nobody else is moving around, try to maintain the distances at all time. If you are having to pass somebody on the walkway, step to the side. You can see in the photographs there are large areas where people could step off to one side to allow somebody past. It's just a common courtesy, really. I don't think that would be too much of a hardship. But this does show again that if the Department for Work and Pensions COVID risk assessment, if this had been properly thought through and set out the thought processes behind it, then they might have avoided attracting this particular criticism. The other thing which the HSE raised in relation to the photo on the left, and I have to say I find this one really quite astounding, is if you look just to the about the middle of the picture, you'll see a high-vis jacket hanging on a coat stand. Yes, the HSE are examining your workspaces that closely. The HSE said that by failing to take that coat stand out of commission, it was creating a common touch point and also creating a gathering point at peak times. Presumably, they're referring to first thing in the morning, last thing at night, and at lunchtime. But I think what that said to me was we all are so used to looking at our own workspaces that we don't see them clearly for what they are sometimes. And it's a great opportunity to go back around the office and think, is there anything that we've missed? Could there be something as obvious as that we've just overlooked because we're so used to seeing it? Again, avoiding criticism such as that is taking the coat stand out of commission altogether, if that is possible, or perhaps asking your staff just simply to keep their coats and personal belongings hanging over the back of their chairs or on their workstations for the day to avoid the need to be moving around the office more than necessary. If we move now to the next slide, which is 2 further pictures from the HSE's notice of contravention. Now, on the left-hand side, that's a fairly common sight in most office spaces. And if that's happening in your workspace just now, then the HSE certainly would not approve. This is an interesting point, bringing in the role of line managers. Now, the HSE's notice of contravention aimed at the Department for Work and Pensions said that this was an end of day meeting which had been called by a line manager to discuss the work arrangements for the following day. Perhaps one of those meetings that ought to have been an email with the benefit of hindsight. But it's worthwhile reminding your line managers in the organisation that they too have an important role to play when enforcing your COVID arrangements and social distancing throughout the workplace. In fact, there are specific legal duties incumbent upon them as managers, and failing to discharge these legal duties could theoretically at least attract personal liability for them. The other criticism which the HSE levied, looking at the next slide, is the use of communal areas. Now, as Lynn touched upon, communal areas such as kitchens are things which we have hopefully all addressed in our COVID risk assessments already. The issue that the HSE took with these 2 photographs was that they did not have not in use signs appended to them. Now, they suggested that the DWP ought to have removed the furniture from the area. And according to them, this was a material breach of health and safety law. My defender's brain struggles with that slightly, given that there is no evidence in these photographs, at least, that these areas are actually being used. However, there is potentially a valid criticism from the HSE here, because by failing to physically prevent your office staff from accessing areas such as this, at a senior management level, you don't always have visibility of what's going on a day-to-day basis. So you don't necessarily know if people are intermittently using them. And if you don't know that if people are intermittently using them, but you're assuming that they aren't, are they included in the end of day cleaning rota for touch points? So it's little things like this that just get us thinking differently about our office layouts. It's also very interesting to highlight how specific and perhaps justifiably critical the HSE are being on these spot inspections. It is not a cursory high-level chat. They are taking it very seriously, as they are obligated to do with good reason. But again, it has to be tied back to what is reasonably practicable for your business. This failure was cited as failing to locate furniture appropriately. And if you don't have space to move the furniture to one side, there are other ways around it. The obvious things, such as taking the chairs away or piling the chairs on top of the table, makes it very obvious that those things are not to be used. But it flags another interesting point. If you have designated meeting rooms as being not in use for meetings, are individuals popping in there throughout the day to take a call or for a little bit of peace and quiet if other rooms are out of use, and accordingly, are they being cleaned thoroughly at the end of the day for touch points? Before I move on to my next slide, I think I would just tie this together by saying, of course, the reminder here is that all of this came about because the DWP had a concerned employee who contacted the HSE and raised those concerns. And as Lynn's mentioned, with the duty to consult your workforce on any changes that you make to your health and safety provisions, you can potentially avoid a whistleblowing incident such as this. Ensuring that that consultation process is undertaken and that it's meaningful, and crucially, that it's recorded in writing that you have had those discussions with your workforce, then that might bring to the fore any concerns that people have and allow you the opportunity to address them internally without the need of involving a regulator and, of course, the associated press and discussion that has followed. So what are the takeaways from the health and safety case study? Well, absolutely, as we can see, these inspections are happening and they are detailed. Commit your plans and risk assessments to writing, even the things that you might discount as being necessary control measures, as long as there's a justification and a reason for it that's supported by your business, then that ought to be enough. Take the opportunity to have another look around your workplace. Has anything changed? Have you missed something? Remember the coat stand? And consult with your workforce. Make sure it's a meaningful consultation and do record it in writing so that you can evidence that consultation process with the HSE if required to do so. If your inspections do result in a notice of contravention being issued or any other form of enforcement action being taken, such as an improvement notice or a prohibition notice, then we really do strongly recommend that you seek legal advice as soon as possible. We've looked in some detail now at the measures for the workplace, and we must just briefly address those of us who are still working from home. This is something which is going to come into sharper focus without a doubt over the coming months. As we've mentioned already, employers are considering it as being a more flexible system of working, and it might become a longer term solution for many organisations post-COVID. For now, if you have staff remaining working from home, then it's good to update yourself on the remaining duties. We are no longer short-term home workers, unfortunately, given that we are 11 months into the process and we do not yet have a date for returning to the offices in all cases. So what do you need to consider for your home workers? Well, firstly, do they have adequate supervision and support from home working? If contact with your employees is poor, then as we all know, this can lead to employees feeling disconnected and isolated. It can also create problems in terms of quality control. Things can get missed, fall off the radar. That all has an impact on people's productivity, their stress levels, and general mental health. We're all working with digital screen equipment, or DSE, as it's abbreviated to. And we did touch on this in an earlier webinar, which some of you may have seen. It does feel like it was a long time ago, mind you. As an employer, you will likely already have given your employees advice on breaking up long spells at the computer, adopting the correct posture positions when working at their computers. But you may now also need to ask your workers to carry out an assessment of their own workspace whilst at home. The Health and Safety Executive have a free workstation checklist document, which can be sent out to employees to complete and then submit. Helpfully, these pages, which are quite succinct, also indicate when you as an employer will have complied with your duty if you follow their steps. I've put at the bottom of the slide there a link to these pages on the HSE's website for ease of reference. You will also have to consider and provide a means of notification for your staff if anybody has specialist DSE equipment needs. Now that might be something like a standing desk or an ergonomic chairs, wrist supports, etc. Bear in mind that the longer we are working from home, and if some of us are having to work in more cramped conditions, then those needs might change. Muscles begin to ache, which they might otherwise not have done in the office. So it's something which should be an ongoing process and kept under review for your staff. Remember also that your legal duties cover the psychological, not just the physiological. So considering your employees' mental well-being is also a legal requirement. Many of the things that I've just mentioned, like regular FaceTime meetings, keeping in contact, goes a long way to dealing with that. But also flexible working requests where possible and appropriate for your business should also be considered and encouraged from employees who might be experiencing childcare issues or caring for other relatives or household members. Actively encouraging your staff to take time away from their desks for short periods throughout the day is also a great way to keep everybody's mental well-being at a better level. We've run some initiatives within Brodie's, which have encouraged people to take pictures of their wintry walks, clocking up the miles for charity events, things like that, that just give people a little bit of motivation, can be great spurs to keeping everybody in a good place. Finally, I'm just going to quickly touch on the consequences of breaching the provisions. Now, we have alluded to these already slightly in relation to the notice of contravention, and HSE are clearly issuing those under the existing health and safety laws for what they consider to be material breaches of the government guidance. Under each nation's coronavirus legislation, there is also specific provision for additional measures to be taken if any individual or a business is not adhering to the guidance in relation to reducing the risks of COVID transmissions. The first of those steps we are seeing is the fixed penalty notice. Now, those carry with them a fine for both individuals and businesses. In the event of repeat offending, then you will find that your penalty automatically doubles. And the fine needs to be paid within 28 days. As with many fixed penalty notices, there is an opportunity to have the fine reduced if you pay it within the first 14 days. If the fine isn't paid within 21 days, then the recipient is referred for prosecution. Interestingly, I did see a report last week indicating that approximately 1/3 of the prosecutions in England that have been brought under the coronavirus legislations have had to be abandoned or thrown out of court for being fundamentally flawed in some way. So whilst this perhaps all feels quite heavy and onerous for employers, I think it might be of some comfort to remember that we are all learning at the same pace. It is new law, and those enforcing the laws are learning them at the same time as those of us who are trying desperately to comply with them. Prohibition notices are the second option, and that will be issued either if the regulator considers that you have not heeded the warning of a fixed penalty notice, or if they consider that the breach is more serious and therefore requires more stringent action. A prohibition notice prevents an activity from being carried out until certain steps have been taken by the business owner or operator. And in more extreme cases, an entire business's operation can be shut down if deemed necessary by the regulator. So if a prohibition notice is served on your business or any aspect of your business, then again, we strongly recommend that you seek legal advice as to allow a prohibition notice to stand against your business can have significant impacts reputationally, but also on your future procurement processes. The final option is prosecution, as we have alluded to throughout, and it is very much a last resort to prosecute, but it can happen. It can happen for individuals and it can happen for corporate bodies. Prosecutions can be brought under the coronavirus regulations or under general health and safety laws. That will depend on the specific circumstances and the nature of the alleged breach. But again, in terms of building your business resilience, a prosecution will attract negative press coverage. They can result in very significant fines for the business to pay. And of course, they can be very time consuming for a business to have to manage and deal with along the way. So best avoided and planned for in advance. That is something of a whistle-stop tour through the consequences, but we would now like to open up the Q&A. I see that we've got quite a few questions come in, which is great. I'm going to have a quick look down them. Lynn, a question for you. In terms of the duty to risk assess, in terms of a duty to consult your workforce, what should you be doing if your workforce are not accepting the remit of what should you be doing if your workforce are not accepting the plans that you have, I think is the question.
Right, great, okay. I suppose the key thing really is that the duty to consult is a two-way process. So if you're getting feedback or concerns raised by your workforce, they should be recorded. If you've got nothing else, the paper trail is really quite key. I think that kind of comes through from both of us, and a consideration of that in terms of what do you think about the feedback? Does a decision need to be taken in relation to that? And if it does, then that really should be fed back. And depending upon, the impact of it, you might need to actually feed that back to the full workforce if they're going to be affected. But just documenting that whole process will help in relation to that. I think there's actually a slightly related question, Victoria, about electronic forms of risk assessments as well. Someone's referred to having electronic risk assessments, induction records, etc. I think they're in the construction sector, but it will be similar for many different industries. And the point that quite correctly raised is actually that can minimise contact with paperwork, which could be a very reasonable step to be taken by employers in relation to minimising the risk of transmission. Paper is a touch point. And so in principle, there is nothing to stop you having electronic formats in terms of your documentation. I think what's important is to ensure that there are an electronic sort of paper trail is kept, so that anytime that risk assessment is updated, you're keeping version 1, version 2, so that you don't lose the paper trail that you're generating, and also that you've got some way to record, whether that's electronic signatures that are date and time stamped, so that there is a paper trail of people reading and understanding those. So in principle, electronic documents are actually a positive thing, but there's just some thought process that needs to go behind that if you're going to implement them.
Yeah, absolutely agree. And a question here about what impact does a prohibition notice have on procurement? Yes, as I just alluded to at the end there, a prohibition notice, if left unchallenged, appears on a public register. And so from a procurement point of view, often you'll find in the tendering stage, you have to declare if your organisation has, it depends entirely on the wording of the question, of course, but it might ask you specifically, have you been or received any enforcement action? Have you been convicted? Two very different things, but a prohibition notice is a form of enforcement action. So you could find that if you have to answer that in the positive, that might take you out of the running of successfully obtaining the tender further on.
There's one I think about vaccines, Victoria. I'm happy to take that. It says, would it be a good idea to ask employees for proof of their vaccine? And what I would say in relation to that particular question is someone's vaccination status is going to be considered personal sensitive data. So this is where the GDPR considerations do come into play, because if you're collecting data of your employees' sort of vaccination status, you need to be clear why you're collecting it. You need to have a legitimate reason to collect it, and what you're actually trying to achieve in terms of recording that is going to come into play. And if you do carry out that process and you can justify why you want to record whether a staff member's had a vaccine or not, you need to be transparent. All the GDPR principles come into play about how you collect, record, access the data, and actually then doing that regular review process in terms of whether you can justify continually collecting that. Do you still have a good reason for doing so? That blog that we talked about will circulate afterwards. It should has a bit more on that.
Yep, absolutely. I think there's a question here I see that's just come in. Where do we stand in relation to health and safety statutory checks servicing during this time when we can't get access to the office? For example, air conditioning, fire safety equipment, emergency lighting. Do we still need to be getting these carried out, or can they be delayed until restrictions ease? I think that's a great question. In Scotland, certainly, these are permitted. These are actions for which access to the office is permitted. I would imagine that for a large chunk of them, particularly fire safety equipment, emergency lighting, these will all be outsourced to an external contractor. So it's there's not really a risk to your staff there, as they are not people accessing the buildings. It is a good idea to allow access, and it is one of the required maintenance exemptions under the regulations, so it can be done and probably should be done so that you don't fall foul of any missed deadlines. I'm conscious that we've just run slightly over time. I'm sorry we haven't gotten to all of the questions in the Q&A, but we will follow up with you by way of email and answer the questions as best we can after them. We would just like to thank everybody very much for signing on today and attending. We hope it's been a useful session, and we look forward to seeing you all again very soon, hopefully.
Thanks, everyone.